So we now know a bit more about our kidneys, what kidney disease is, why it needs to be effectively managed, and how we can detect it, and what we can do to look after our kidneys. A second DVD will cover management of CKD from stage 4 to end-stage renal failure or ERF, where patient care moves from the GP practice to the renal unit and nephrologists like Dr. Paul Stevens. If you do get a referral, don't panic. Remember, the more you can understand what's happening with your CKD, the better position you're in to make the right choices and decisions about treatment options and how you're going to live your life. It's still very much down to you.
Patients will be referred for a number of different reasons, depending on how they present to their general practitioner. So there are probably some key questions that people who have kidney disease should want to know, and they should want to know whether or not their kidney disease is stable, if it's progressing, what rate is it progressing, and when might they be needing to do something about it. They should ask what their blood pressure is, because if their blood pressure isn't well enough controlled, then their rate of progression may be more rapid. They should be very interested in whether or not they have any complications of kidney disease, complications such as anemia. Those sorts of things are the sorts of questions that they need to be asking the doctor who are looking after them. Yes, the team approach to managing kidney disease is not only in hospital, it starts outside hospital in the community, and then comes into the specialised kidney clinics that we have. For example, here at Canterbury we have what's called an advanced kidney care clinic, where not only will doctors be there, but also nurses looking after access procedures for dialysis, nurses looking after anemia management, and we'll also have dietitians, social workers, counsellors in that clinic, so that patients can tap into whatever resource that they need.
I'm just coming to review your blood levels and see how your diet's going this month. So if we could just have a quick look at your blood levels. Yeah, your potassium's looking good. Your phosphate level is 1.4. And your protein levels are super, that's 38. And your diet...
There's a lot of research in various different areas. Perhaps key is early identification of kidney disease and research aimed to identify those at risk and prevent progression of kidney disease, but also to try and identify people right from the outset and attempt to prevent kidney disease in the first place. Positive outlook has a huge influence on your quality of life. Undoubtedly, if people can stay positive, people can take control of their management. Certainly people who want to get involved in management of their kidney disease, we should encourage them to do so. We should give them the tools to do that. But equally so, there will be some people who want to compartmentalise their disease and keep their home life completely separate. And again, we should be alert to their wishes and try and accommodate them as much as we can. Teamwork continues through into the dialysis unit, and in any dialysis unit in the country, not only will there be doctors passing in and out of the unit, but again dietitians, the anemia management people, nurses themselves, and the various other people that together furnish the care for people with kidney disease.
I hope you'll find this reality check on chronic kidney disease useful. Elsewhere on the DVD, you'll find other sources of information, literature, websites, organisations that can expand your knowledge still further. And the second DVD module, What You Need to Know End-Stage Renal Failure, will be available through your local renal unit. Goodbye and good health.